Very good saying. Who are we?
I'm Dr. Steph Ganter,
Dr. Robert McNeil.
and we are
Between Two Teeth.
Between Two Teeth.
You gotta show your tooth way up there.
Tooth.
All right, we're trying to have fun, serious conversation. Oh,
Well, actually, this is a fun topic because it's so topical. Can I use that right? Is
Okay.
that kind of a play
Yeah.
on words too much? All right. About dental compacts and dental licensure broadly. So, Dr. Robert McNeil, how do you want us to?
I go by Bobby.
He goes by Bob or Bobby. Okay, so Bob, how do you? Let's start small. What
Okay.
is a dental compact?
Dental compact is basically like how a driver's license works. You leave your state, you don't need a new driver's license when you enter a new state. The Department of Defense gave a bunch of money for the ADA and a couple other groups to figure out how can you make something happen.
Whoa. Department of Defense. That sounds important.
Yeah, it does.
Why does the Department of Defense care about dentistry or
here's
licensure?
So here's the deal. They actually have problems as the service members get transferred. Both the service members and especially their spouses have trouble with licensing issues. So it's a big deal. Unfortunately, it disproportionately affects females. And it takes time to get a new license in a new state. And they're like, hey, other professions, other healthcare professions, nursing, medicine, they have compacts. Dentistry's next in line. Something's happening right now. That's what we're talking about. And we're trying to initiate meaningful conversations about it in a fun way.
Conversations between who? Who are these groups here?
The main groups are the examination community.
Hold on. So the examination community is going to be this
all right, that one right there.
fuchsia rose. Okay.
And that's people that are on state boards, part of
State boards.
CDCA, REB, CERTA, those things. It used to be actual patients transferred to Mannequin. That's
regional licensure examinations.
Correct.
And then also state boards.
Second stakeholder group.
Is there yellow rose?
Oh, that's nice.
Oh, yes. Okay.
The American Dental Association, the communities that develop something called the DL-OSCE, the Dental Licensure Objective Structure Clinical Exam.
Okay.
Computer
Organized
exam.
dentistry is this, Rose.
Pretty much, and some other associated groups. The educational environment comes in to
ADEA,
really
maybe?
both of these.
Okay.
But here's the deal. Two separate roses. We want communication to take place between the two of them for the betterment of the entire.
Talk about how can it be better? What's your vision here?
So pretty much both of these two groups developed separately for a variety of reasons. We're at a point now where perhaps the compacts are going towards one rose and not both of them.
Oh, okay. I gotcha. So maybe our
Great
future
analogy, by the way.
Thanks. So maybe our future here is trying to start a conversation.
Trying to start a conversation.
Are you saying both roses have a good point or have a benefit?
Oh, I like that. A point. Yes, roses do have a point.
See what I did
see
there?
what you did there. That's fantastic. So they do. And I think having a computer-based OSCE examination can be important. Having a hands-on Mannequin component can be important. And I know you actually changed my mind frame on this. Long time ago, I had a different opinion, but you helped me out.
I appreciate that. And for me, I'm not relevant to these conversations. What I can do is have a personal experience. When I was in dental school, taking my fourth year licensure exam, I actually failed the first time. And it wasn't because I had a poor dental training. I went to I had a great dental education. It was just poor self-awareness. I didn't realize how much I actually needed to practice to meet the rigor of the Mannequin portion of this exam.
And I think
it helped me a lot.
On my own side of the equation, being a part-time faculty member at a dental school, I can appreciate the need for that. Being on the state board, I can appreciate the need for some hands-on verification. And the way things go, if the compact is just heading towards one rose and not both roses, I'm afraid it's going to stay small as far as the number of states that are going to participate in this thing. That's not what we need.
That's a good point too, because I know since you've been in ASDA and then even since I've been in ASDA, it's the same conversation. So it's time for a change.
Licensure is a long process. I remember 20 years ago when I was ASDA president, there were lots of issues. Things have developed independently. It's time to have those conversations to bring it together. You're a periodontist. Yeah. I'm an oral maxillofacial surgeon. We are in a unique practice environment. We appreciated the fact of working better together. I guess we're kind of like this. Which one do you want to be?
I like the fuchsia.
Oh, I like
I'm gonna
this.
go the
Yellow's
fuchsia.
friendly. But we got together to improve patient care, and it made both of us individually better. I think the same can happen with compacts.
I love that. And to be fair, I mean, you started that conversation. It's nothing that was a normal thing. And quite frankly, I mean, it hasn't come without its challenges too.
One of the
Because we are
things,
trained differently.
you're not wrong. And one of the things that I learned out of my MBA training was negotiation management, having appropriate conversations, even if they're difficult.
Mm.
Sometimes it means putting egos aside. For you and I to get together, Perio and OMS, we had to put egos aside and say, what's going to be a good outcome?
And the thing here is, it wasn't putting egos aside. Like, okay, we're going to stamp the books right now. Day one, egos are aside. It's every day.
It's an evolving process.
Every day.
It is. And there has to be give and take on both sides.
Yeah. And it does come back to self-awareness, the leadership. And fortunately for us, we're in a position where we have a different look completely, a different perspective.
We do. And we are connected through various people. Me being a board examiner with CDCA Reb and being on the Texas State Board, you being
ADA Council member.
ADA Council and representing the new dentists. We have different spheres of influence. And I think part of why we're doing this video is to really push people that are part of the process to engage and have those difficult conversations. Because we want a compact to be big.
Yeah.
We want a universal approach of here's what licensure is. It's a DL-OSCE. It's a hands-on mannequin component. Most states should accept that. That's going to help out with telehealth issues, with mobility issues. If I want to semi-retire and move to a different state and easily have ability for licensure, that can be important.
All these are fantastic.
How do we wrap up this conversation?
Well, I would just say, can we dub you with the new title? Dr. McNeil, Robert McNeil, conversation starter. And the idea here is not to start the conversation about a national licensure. That's a conversation that has been started for a long, long time.
Right.
What we're talking about is starting a conversation between the main stakeholders.
And to do it for the right reasons and have a universal set of standards that's going to move us where we need to go.
Right. Because as a profession, I think we all want a better future.
Better for the profession, better for the public, better for everyone involved. So
fantastic, guys.
Thanks for joining us. I know this was more of a serious discussion than sometimes.
Still lighthearted and fun. These roses will be available on eBay for sale if you want to buy them.
Rose analogy.
Absolutely. Thank you, guys.
Thanks,
Appreciate it.